Hi, I'm Stacy Thompson, and I am one of Dr. Gerson's nurses, and I am here today to talk to you about what life is going to be like when you go home from your surgical procedure. So after surgery, when you go home, you are going to be able to walk, you're going to be able to do stairs, you'll be able to get up in the morning, get washed, get dressed, brush your teeth, make a simple breakfast, eat your simple breakfast, and then you are going to be ready for a nap. The first 2 weeks for sure, you're probably going to need a morning nap and an afternoon nap. The procedure itself is very exhausting, so you will find you will need to rebuild your strength and stamina over these first 2 weeks. The procedure is also post-operatively very painful, and that is because of the instrumentation. Most patients tell us that it's very similar, the pain is very similar to the pain that you experience with a hip replacement or a knee replacement. So we will be providing you with narcotic pain medication. We also will be supplying muscle relaxants. The reason for the muscle relaxants is you have a large group of muscles that lay right here over the spine, and Dr. Gerson will not cut through those muscles. He's simply going to move those aside. However, those muscles are very sensitive. They do not like to be touched. They do not like to be moved. So that leaves the patient very prone to muscle spasms post-operatively. If you're a patient who has had muscle spasms preoperatively, you most likely will experience muscle spasms post-operatively. Some patients tell us that they did not experience muscle spasms at all after surgery. Other patients tell us that the muscle spasms were more severe than the incisional pain. So it really depends. It's very individualized how your body is going to respond. So we are not going to know until you undergo the surgical procedure how your body responds to that. So we're going to make sure that you're well medicated. Many patients come back to us at their follow-up appointment and they're already weaning from the narcotic pain meds, but they're still regularly taking their muscle relaxants because they are still having spasms, and that's okay. We're okay with that. After surgery, you're going to have 3 main restrictions. No heavy lifting, so that means nothing greater than 8 pounds, which is the plastic gallon milk jug you will put in your refrigerator. No bending at the waist, no lifting at the waist. So when I say no bending at the waist, I mean no bending all the way from a standing position down to the floor to pick something up. So I want you to bend to the floor by taking a squatting position or by going down on one knee to pick something up. When you come back for follow-up, if you follow those 3 restrictions consistently through your post-operative period, that spine will start to heal really well. The other thing I want you to really think about is listening to your body. Your body will tell you what it needs during that post-operative period. So if your body is telling you that it's tired, then I want you to nap. Your body is going to heal when it's resting. So, you know, 1 nap in the morning, 1 nap in the afternoon, those first 2 weeks will probably be needed, maybe even for longer. I think that walking, I want you to walk every day. I don't want you to develop a pneumonia. I do not want you to develop a blood clot. I think that walking after a spinal procedure is really the best thing that you can do for yourself. It's good cardiac exercise, it's good pulmonary exercise, and it will help to strengthen all the accessory muscles, so all of the muscles surrounding this incision on the spine. Your incision oftentimes will have drainage, and that's normal. The drainage should appear a watered down pinkish color. Sometimes there will be a lot of drainage. That's also normal. The things that we want to look for with concern to your incision is that, is the drainage brown? Is it green? Is it yellow? Those would be concerns for infection. Are you having a temperature of 101.4 or greater? Is the skin surrounding the incision on either side, does that feel warm to touch, or does it look red? Those would all be signs of infection. So if you're seeing any of those symptoms, I want you to contact us. Otherwise, drainage from that wound can be very normal. I hope that this presentation has helped answer some of your questions. If you have any further questions, please don't hesitate to ask. Thanks so much.